morning, everyone, and welcome to this meeting of the Perth and Kinross Integrated Joint Board Audit and Performance Committee. For anybody joining online, I wish to apologise for the delayed start. This was caused due to either Monday morning gremlins or a technical hitch, possibly a mixture of both. But I believe we're all here now. This is a completely virtual meeting. So if anyone has any questions or any points they want to make, can you please access the chat and put either Q in the box or comment if you want to make a comment. So thank you very much. Do we have everybody online that is due to attend?
Yeah, thanks, Chair. I'll firstly go through the apologies that we've received this morning. So we have apologies from Martin Black, Beth Hamilton, and also from Jackie Pepper. In terms of the members present, we have yourself, Councillor Illingworth, and Bernie Campbell. So in terms of being quorum, we're okay for the meeting to continue. And everybody else that we need appears to be online also.
Thank you. Okay, so we'll move swiftly on to the first order of business. Are there any declarations of interest on any of today's papers? Can you please put DI in the chat if there is? I see no declarations of interest, so we'll move on to the minute of the meeting of the 11th of December 2023. Are there any corrections, matters arising or issues with that minute? If there are not, I don't see anything coming in the chat. In that case, can I have a proposer and seconder, or are we happy to accept the minute?
Happy to propose.
Thank you, David. I'm happy to second for the record. Okay. So now we move on to item 4 on the agenda, which is the action points update. I think it's fairly self-explanatory. Is Jackie in the meeting today? Kenny, can you provide an update to that?
You bear with us just 1 second, Kenny. I know that Phil would normally lead this section with the actions update, but both Kenny and Phil and I are having continued connection issues. So if you could give us just 30 seconds, we'll see if we can get that.
Okay, so I'll just cover both of the 3 action points in. So the first 2 items, reference 52 and 54, they've to be taken forward with me. And obviously we've not had a chance to do that yet, so we'll need to revise the timescales. Hopefully we'll have those actions completed by the start of the next meeting. And the last item, the RAG status of the Partnership Improvement Plan, is to be updated to reflect all statuses, and that will be updated when the Partnership Improvement Plan is next considered by the committee in June 2024. So I think all of these actions will be taken forward to June. Are there any questions on the action points? Any actions or comments? I see some shaking heads, but I don't see anything else. That's fine. Thank you very much indeed. So now we move on to the financial position, and I can ask Donna Mitchell to introduce that paper, please.
Yes, thank you, Chair. Good morning, everyone. This report that we've got today brings the 3rd financial update for 23-24, and it is based on the 9 months expenditure covering April to December. So I'll just do a quick introduction and keep time for questions or discussions. But I am pleased to report that the projected position is an improvement from the report last presented to the committee, and the forecast overspend has reduced from 2.1 million to 660,000. This movement is due to a number of small variances adding together, but the key area that I would like to highlight is in relation to the older people's projected expenditure. That's reduced, or the projected expenditure is reduced by 484,000 since the last report. This is partly due to a decrease in agency usage within care at home, with all agency use now ceased, and that need is being picked up by both our internal and external care at home. We have also had a reduction in the forecast expenditure against care home placements. It still remains in an overspend, but the forecast has reduced. The areas of unplanned overspend across all services remain within the services as we've previously reported, and they are listed in section 2.5 of the report. Another area I would keen to highlight is in regards to the reserves position. So after this overspend of 660,000, it would mean that our reserves, our general reserve, is around 4 million proposed to be at the year end. And this figure will be the one that is considered as part of the budget and the financial strategy that's coming to the IJB on the 20th of March. Also in relation to reserves, but to our earmarked reserves, as per section 5 and paragraph 5.3 of the report, the IJB approved the use of 650,000 of earmarked reserves in order to contribute to the overall inpatient mental health service shortfall, and that's been reflected in the appendices in this report. The risks to the financial position in 23-24 are reducing as we progress through the year, but those that remain are detailed in section 6 of the report. So although the position has improved, due to the IJB remaining in an overspend, the executive management team are continuing to scrutinise expenditure, and we are keeping the financial position under regular review. But I'm happy to take any questions or have any discussion around the report at that stage. Thank you.
Thank you, Donna. I'll invite now questions from members and attendees of this committee. Again, if you can put Q in the chat. If you don't have access to the chat, then please raise your hand and hopefully I'll see you. Bernie has, I'm told Bernie has a question. Bernie?
Yes, thank you. It's on, I think it's 3.9 of the report, and obviously we're saying about underspends, which for the partnership, I understand it would be good, but my concern is it talks about significant underspends in daycare, and it also refers to underspend for respite care. I suppose I'm wanting to know, is it the fact that it's not that there isn't the demand for the service, but there's not been the opportunity for accessing that? I refer to that as in relation to respite, as we certainly know from our unpaid carers that there has been some challenges or difficulty in accessing respite. So I'm, I suppose it's to confirm the fact that it's not that the demand isn't there, it's that the opportunities haven't been available. And the daycare, we see that people are looking for daycare, but I'm surprised that again that there's an underspend, and is that due to the fact that it's the demand is there but the opportunities are not? Thanks.
Thank you, Bernie. Donna, do you want to take that question, please?
I think I would probably refer to Kenny. Thanks, Kenny.
Okay, Kenny.
Yeah, thanks. I can come in there. Yes, Bernie, you're perfectly correct. The underspend, certainly in terms of respite, isn't indicative of a lack of demand. There are issues accessing respite in terms of people choosing particular care homes in particular geographical areas, and that's certainly something that has been passed on to our policy and commissioning team, which we're looking at. So, yeah, the demand is greater than that underspend suggests. And the same potentially is true of the daycare, but possibly less so. I mean, that budget refers specifically to daycare that we purchase in from the independent and third sectors. And certainly historically, a lot of our daycare provision has been provided in-house. Although that said, there are still vacancies in our internal day care centres as well, although the attendance has increased. And, part of this was due to the pandemic as well, just people coming out of the pandemic and getting more reassurance that it is safe to go out and actually interact with other people. But certainly in terms of the daycare, we are currently reviewing our daycare provision to look at seeing what we can do to enhance that in terms of quality and in terms of geographical spread across Perth and Kinross.
Thank you very much, Kenny.
Thank you. I don't see any other questions in the chat. I just have one question then myself, and this is for Donna. In terms of the projected reserves position, can you tell me what that is in terms of percentages? Appendix 3, I think.
Yeah, so the 4 million projected general reserve level, Sheila, is 1.6% of our budget, which is below the reserves policy aspiration.
Okay, thank you. Are there any other questions before we move on to the next item?
Can I just comment?
David, yes.
Yep. Well, it's great to see the overspend reducing significantly. That's fantastic news. I do think we all need to be very nervous about the low level of reserves, as Don has pointed out. So thank you for making that comment.
Thank you. Are there any other comments? Okay, I don't see any other comments in the chat or on the screen. So thank you, Donna, for that report. And we shall now move on to item 4.2, which is the Key Strategic Performance Indicator Report, Q3. And can I ask Chris Jolly to introduce that report, please? Thank you.
Hey, good morning. Thanks, Chair. Thanks, Audit Performance Committee. This is our routine performance report to the committee, covering the core integration indicators up to the end of Q3, as the title suggests. Following this report, we will bring forward to the Audit Performance Committee our annual performance report later in the year, and that will cover the full year's activities, excuse me, with performance data associated with that. Focusing on the Q3 performance against the core set of indicators, we can see that performance is good overall. We can see that the effects of the work that has been progressed to support our capacity and flow is coming through into those. Is coming through into those indicators. The report provides detail in chart and tabular form within the appendices, but I'll draw your attention to the key messages from that. Excuse me 1 second. So key messages: emergency admissions have improved since last October. That was the last time this indicator was reported to this committee. It was December was the last time we reported that the performance in respect to emergency admissions has improved since October. Occupied bed days have improved by 2.2% since last year. This is supported by improvements in the length of stay that we can see operationally, and that's the length of stay of people in hospital. Emergency readmissions have improved since last reported, and it's important to note that overall numbers of readmissions are relatively small. We have reported some more detail on this to the committee previously, and continue to focus on our understanding of the reasons behind readmission, notwithstanding the fact the numbers of actual readmissions is quite small. The rate of emergency admissions due to a fall has improved since October 23 and remains stable against last year. And this is a good picture given our known increase in frailty. And I'd particularly like to draw attention to the improvement that we've seen in delayed discharges, which have improved by around 19% by comparison to last year. The report continues our approach to providing the committee with care group KPI reports as well, and this particular report provides Appendix 2 a KPI report on learning disability and autism. Performance against the delivery of that strategic delivery plan is good, with almost all indicators green when considering the target set. Some of the indicators are reliant on data generated from our survey of patients and service users, and we acknowledge that the size of the client group being relatively small can mean that the responses to that particular survey are also quite small. We do additionally receive feedback from people using our people that use our services using the Care Opinion service, and we've also included examples of feedback through that route within this report. Members of the committee will note that we've included an outcome 8 on this occasion, which focuses on a reduction in health inequalities, and that's a new indicator which approval will need to be sought through the IGB for, but we've included it for the purposes of this report as it adds to that which is already there. 2 of the indicators require additional work to gather and present the necessary data, and that work will continue ahead of next being reported to this committee. Just to note that the IGP will receive a fuller update on this strategic progress in respect to the LD autism strategy when it next meets on the 20th of March. I'm happy to pause there and take any questions.
Thank you, Chris. Are there any questions? I have one question, Chris, if I may. First of all, I want to congratulate the team on the work that they've done in this area. As some of you will know, I have a particular interest in the learning disability and autism performances. But one of the questions I wanted to ask is, can you hear me okay?
Yes, yes.
Oh, good. Yeah, must be some interference in the background. One of the questions I wanted to ask is, in terms of gathering the data, do you only speak to the service users themselves, or do you also speak to guardians and family members and of people who have perhaps a low level of understanding?
You're happy to come in initially. I don't know whether Gillian Morrison, who's with us today, may want to comment as well. Certainly the survey is created in a way that allows patients and service users to provide their feedback, and that can be facilitated if it would be challenging for them to do so. So my understanding certainly is that that's the case, and we have created easy read versions of the survey which allow service users greater opportunity to provide that feedback. I don't know whether Gillian or Kenny will be able to comment further.
Kenny, do you want me to come in there? Yeah, hi, Gillian Morrison here. Yes, we do gather information from both the service user and carers, guardians, and those that support the individuals as well. And that's not just through the surveys or that Chris has spoken about, but also through our strategic groups as well, because we've got carers on those strategy groups that do come along and feed into that. Hopefully that will answer your question.
It does kind of, but maybe, yeah, I think not every, I've mentioned this before at previous meetings, either at full IGB or at the Adult Protection Committee, that not all people who provide care and guardianship are members of the groups. And so it's how do you reach out to those, and whether or not the service users themselves have to initiate the involvement of a guardian when they may have a low level of understanding, or whether it's proactive on our part to approach family members and guardians. So I'm just really trying to understand how that works. Who wants to answer that?
So everybody has an opportunity, I suppose, through the strategy groups, and we also have through consultation. So we've done some work recently around autism and mental health, and we've got workshops coming up in regards to that. And that is, again, we try to get out to as many people as possible to invite them through the third sector partners as well, who often have relationships with the individuals, carers and guardians who are able to support and people to come into these. So we've got 2 workshops coming around specifically around autism, and we're also doing a session around the new LDAN bill that's coming out, again to be able to support consultation and discussion, and we're including, you know, those with a lived experience, carers, guardians in that as well.
Okay, thank you. I noticed that Bernie, you have a question?
Yes, thank you. But actually, I'm wondering, I may be incorrect here, but it was in relation to outcome 5, which refers to ensuring that people are able to participate in the communities, and it refers to the day opportunities, and it just talks about that it has increased by 9.3%. So I was linking it back to my original comment, which was talking about the underspend in day opportunities but I'm actually wondering if the 9.3% refers to learning disability. So apologies if I've picked that up incorrectly.
Yeah, Perry, that does refer to our Learning Disabilities Day opportunities in-house services, and that's the fund network as well as our Day Opportunity Service. And we're recognising actually we're getting to capacity, so it's how we're going to be able to deliver that going forward as well, recognising the need that's out there.
Thank you.
Does that answer your question, Bernie?
Yes, sorry. Thank you very much.
You're welcome. David, Councillor David Illingworth, you have a question?
Yeah, thank you. Two of the reds refer to emergency admissions. Can you give me some information on the strategies that can be put into place to reduce emergency admissions?
Thank you. David, who wants to take that answer?
I could come in there, Chair.
Thank you.
I mean, basically, there's a lot of work ongoing and has been in place for a while to try and reduce the number of people being admitted to hospital in an emergency situation. We have been trying our hardest during the current budget setting, as you know, to keep the emphasis on the funding for community-based services to do exactly that. You know, we're having to make some pretty challenging decisions elsewhere, but we're doing our very best to try and maintain our strategic direction, and that is to make sure we've got our community-based services up to capacity and working as effectively as possible to try and reduce the risk of people being unnecessarily admitted to hospital. And a lot of that focuses around our Link service, which we talk about, and that's improved integration mainly of our health teams, and the next step is to increase our social work teams and have fully integrated care teams in each of the sub-localities with a small geographical base, with a range of tools and supports, working closely with GPs to reduce admissions. And part of that is increasing the medical resource that's available for those teams to access as well. And again, like I say, to try and maintain people at home and increase the number of medical interventions that we can support people with in their own homes rather than going into hospital.
Thank you. Kenny?
Yep, thank you.
I don't see any more questions in the chat. Does anyone have any comments they wish to make on this report? No. Okay. Well, in that case, I would like to move the report and ask everyone that we note the strategic performance in relation to the core suite of integration indicators, and that we note progress in the delivery of the outcomes defined within the learning disability and autism strategy, including the addition of a new outcome 8. Is everyone noting that?
Agreed.
Thank you very much. And I missed the fact that we also need to do the same for report number 4.1. The recommendations are that we note the overall projected outturn for 23-24 based on financial performance to the 31st December 2023, that we note the work undertaken by the Chief Officer and Executive Management Team in continuing to mitigate cost pressures in the current year, and note the financial risks as detailed in section 6. Do we note that report also?
Agreed.
Agreed.
Yes.
Thank you very much, everyone. In that case, then we will move on to the governance assurance section of the meeting today, and the strategic risk management update. And Chris Jolly, I believe you're in the chair again.
Indeed. Thank you, Chair. Again, this is a routine report to this committee covering the strategic risks in relation to the Integration Joint Board. Strategic risk was last reported to this committee in December 2023, and there have been a number of changes that I'll take you through just now. So strategic risk SR06, which is the viability of commission providers, has had a change of score, with the probability increasing to 4, giving an overall score of 16, making it a red at high priority risk. This change largely relates to issues being experienced in relation to the National Care Home contract, and the changes haven't been made to international recruitment processes. SR11 in relation to sustainability of primary care services. That risk we've had on our risk register for some time, but we have altered the description to mirror that which is included in the risk registers of partner bodies across Tayside, and that's just recognising that there are similar issues that are being managed across the whole patch. We have, however, included an additional element to this risk description in P&K to recognise more fully the issues that we have around access to services in rural areas. So there's an added rurality element with nuance, you might say, within Perth and Kinross, which is not experienced to the same extent elsewhere. SR15 has been included. That's a new risk for the IGB Strategic Risk Register and covers mental health and disabilities whole system change programme. This has been a piece of work that has been taken forward for quite some time across Tayside, where we seek to get recognition across each of our partner bodies to include this risk description on each of the partner bodies' risk registers, in clear recognition that no one part of the system can fix the issues that we know exist there. Committee members will note that risk hasn't yet been scored, and there is additional work being taken forward just now with partner bodies to appropriately score the risk and include additional elements such as causes and consequences and the wider elements of risk management. So that work will be taken forward as we move forward from this committee to next. The only thing I would say in addition at this point before a pause would be that members of the committee will know that we've got an IGB development session on Friday this week where we'll look to discuss our risk appetite, which is something that we've discussed with IGB members before, and we look forward to that discussion on Friday, which may change how we report things in future. So it was just to trail that ahead of Friday's development session. Happy to pause there.
Thank you very much, Chris. Do we have any questions for Chris on his report? Well, in that case, David, you have a question?
It's about sustainable capacity and flow. Given that SR1 and SR2 are red, it does seem to me that it's going to be hard to deliver sustainable capacity and flow, and perhaps those should be red as well. But I'm happy to listen to what the experts think.
Thanks, Councillor Illingworth. I think it's a fair challenge. It's often a judgment call to be made at a particular point in time. I'm not sure whether Donna or Phil want to comment.
I'm happy to come in there, Chair. As you said, it's a fluid situation. I mean, at the moment, we're currently sitting at amber for delayed discharges in Perth, and at the end of last week, we're actually green across Tayside. So the situation isn't too bad at the moment, but as we all know, it can change. And you're right, SRO1 and SRO2 can potentially have a significant impact on capacity and flows. So it's something we're obviously monitoring on a hourly basis. I wouldn't even say a daily basis, and we're doing everything we can to mitigate any detrimental impact of those first two risks on capacity and flows through a variety of measures, which we've discussed. The care at home transformation programme, increasing capacity there, focusing on integrating our integrated discharge hub so it's working more effectively, etc., etc.
Thank you.
Thank you, Kenny. Does that answer your question, David?
Yep.
Okay, so I have a question on item SR08 on health inequalities. I'm just wondering, as part of the mitigations in appendix, or the action plan in appendix, sorry, I've got 3 screens going here, appendix 3, apart from the interim head of adult social care in terms of commissioning, I'm wondering what engagement you're having with the main body of Perth and Kinross Council, because health inequalities are often impacted by things such as housing, access to services, etc. So I'm just wondering if there's a part of that action plan that needs to include engagement with the local authority? Who would like to answer that? Kenny?
I could come in. Yeah, it's a fair point, and as we all know, the Health and Social Care Partnership can't be the answer to everything. We have to work with partner agencies, and yet the Community Planning Partnership in particular is a key role to play here in terms of mitigating impacts of any inequalities and challenging poverty, etc. And there certainly is a lot of work going on council-wide at the moment. They're looking at setting up boards. And I believe one of the boards will be focusing on poverty. I'm not sure if there'll be an inequality element in there, but by definition, if you're tackling poverty, you're addressing inequality as well. So we all know the council's recently had a restructure and it's got a new management structure in place. So there's an opportunity there just to review how the Community Planning Partnership works, make sure it's more effective, and make sure we're right through the centre of it as a partnership.
Thank you, Kenny. Yes, I agree. And my question is partly in the context of that restructuring. I think the strategic leads, the two key strategic leads reporting directly to the Chief Executive, need to be key to that. And while I understand the Community Planning Partnership has a role to play, I think there's probably some merit in having a more tactical engagement on an ongoing day-to-day basis with both of the new strategic leads. Or the executive directors, in order to ensure that it flows down smoothly through all the service groups. So I think that's maybe something to take away and perhaps consider including in the action plan going forward. Right, I don't see any other questions on this paper. Are there any comments? Don't see any comments either, in which case then we will move to note or look at the recommendations for this paper, that the Audit and Performance Committee is asked to note the increase in risk exposure for SR06, viability of commission providers, to note the new narrative as set out at section 3.4 for strategic risk SR11, sustainability of primary care services, strategic risk, note the new strategic risk SR15 as set out at section 3.5 concerning the whole system mental health and learning disabilities change programme. Do we all note those points, those recommendations?
Agreed.
Thank you. And we are also asked to approve the Integrated Joint Board Strategic Risk Register and Strategic Risk Improvement Plan. Do we approve that?
Agreed.
Agreed. Thank you very much. So now we move on to item 5.2. The internal audit progress update, and I think is Jackie Clark in the meeting. I think Jackie, you're going to lead on that.
Thank you, Chair. Yes, this report provides an update on activity since the last meeting of the Audit and Performance Committee. As you can see from the report, which I think is quite self-explanatory, we are anticipating a draft report will be issued very, very soon on the premises and property assignment from a previous year. The scoping has commenced with all other assignments, which is being undertaken jointly by ourselves in Perth and Kinross Council, but also by colleagues in NHS Tayside's internal audit functions. It's anticipated at the moment that the majority of the work will be completed and hopefully reported by June, in line, which will fit in with the provision of the my annual report and also the annual governance statement. I'm happy to take any questions.
Thank you, Jackie. Are there any questions for Jackie on her report? I don't see any questions for Jackie. Are there any comments? Well, the comment from me, Jackie, is you do very good work and thank you very much for your report. We appreciate all that goes into doing the internal audit plan. Thank you. So now, now we come to the recommendation, which is fairly straightforward. The Audit and Performance Committee is asked to note the progress made in the delivery of the 2022-23 and 2023-24 plans. Are they all duly noted?
Yes.
Thank you very much.
Agreed.
Now we move on to item 5.3, which is the audit strategy. And I believe we have Maggie Bruce here from Audit Scotland to speak to this report.
Yes, thank you, Chair.
Hello, Maggie.
Hello. So the plan you have in front of you today is for the 23-24 audit of the IJB. I'll just highlight a few key points for members. The first one is at paragraph 8, where we're asking for those charged with governance to provide me with an assurance that you aren't aware of any suspected or alleged or actual frauds that need to be brought to our attention as part of our planning processes. And if I could get a positive assurance on that, maybe at the end of this item, then that would be helpful. The plan sets out our materiality levels. These are the levels that we work to in coming to our opinion on the financial statements. Exhibit 2, we set our significant risks of material misstatement for the IJB financial statements audit. We only have one in there which we cannot rebut. It's a requirement of all external auditors to consider that. And the planned audit response is set out in the final column of that table. We also undertake a wider scope audit for the IJB, where we consider financial management, financial sustainability, vision, leadership and governance, and also the use of resources to improve outcomes, and commentary on that will be included in our annual audit report to be considered at the October meeting of this committee. Further on in the report, we set out our timetable for the audit and also the audit fee, and I understand that there's a separate report coming up to members on that following on from this item. The only other thing I would draw members' attention to is a change in the engagement lead for the audit. Brian Howarth is paragraph 34 of the plan. Brian Howarth is retiring imminently and is being replaced with Rachel Brown, who is also an audit director. Rachel has significant experience in auditing IJBs and is unable to be here today, so she has asked me to pass on her apologies. She would have hoped to have been here, but she's actually on pre-planned annual leave today. So that's all I would wish to say in connection with my plan, but of course happy to take any questions. Thank you.
Thank you, Maggie. Do we have any questions for Maggie, please?
Okay, can I ask 2 questions?
Yes, David, yes.
Okay, the first one is, apart from what you was saying about fraud, are there any other differences between this audit plan and last year's audit plan?
No, and the fraud point was also in last year's audit plan. It's a requirement on external auditors that we ask those charged with governance, i.e. yourselves as the committee, to confirm to me that you're not aware of anything that would impact on our audit approach.
Okay, and the second question is around timetables. Are you confident that you can meet these timetables?
We are as confident as we can be. We met a similar timetable last year and we are slightly ahead of where we were this time last year, because last year was our first year of the appointment. So yes, we are as confident as we can be. What we can't plan for is, unplanned leave, sickness, absence, etc. So yes, quietly confident, but can't give an absolute assurance.
Okay, great, thank you. Thank you for both those answers.
Thank you, David, and thank you, Maggie. I actually was going to ask the same question about timetabling, Maggie. I do know from other committees and boards that I sit on that there has been some delays and there has been some capacity constraints and within Audit Scotland. So I'm wondering if there's any further. I'm assured that we have new people appointed to the team, but I think this is something that's causing me a great deal of concern, because October, really is about as late as we would like that to be. And any further slippage, I think, would have quite serious ramifications. So I note your response to Councillor Illingworth, but please, I would like you to know that that is a matter of concern for me, and I will be keeping close monitoring of your ability to keep to the timetable overall. Thank you very much. If there are no more questions, are there any comments on this report? And can we note the report then, please?
Agreed.
Yes.
Thank you very much.
And do we also need to give that assurance to Maggie?
Yes, please, if you could just say something positive about whether you are aware or not, just so that I can record it in our files, please, and it will be on the record. Thank you.
As chair, newly chair in this committee, I am not aware of anything. I'd perhaps ask Donna Mitchell if she has a comment to make on that.
I would have nothing to advise the committee of that said that you couldn't give that assurance to the auditors.
Thank you very much. Is that duly noted? Thank you. Okay, and now we move on to item 5.4, which is the external audit fee.
Thank you, Chair. So the audit fee, similarly to the audit plan, the audit fee is brought to committee each year for approval. The fee has increased by 6% since last year, and Audit Scotland have provided an explanation for the increase, and that's in section 2.4 of the report. I do understand that the CFO section has written to Audit Scotland raising concerns around the increase and asking for a review of future fees, but mainly seeking assurance that actions are being taken by Audit Scotland to manage the fee increases. I would, however, ask the committee to approve the fee for 23-24 so that we can progress with the audit with Audit Scotland, and I will bring back any feedback from Audit Scotland in regards to the concerns that have been raised, and I would bring that to any future committees.
Thank you, Donna. Are there any questions for Donna on this report?
Yeah, I noticed
David.
The rebate. Can you talk us through this? Because rebate was quite high last year. It's a bit lower this year. What is the story behind the rebates?
Yes, and I may need Maggie to help me with that one, but I think the rebate was applied for reduced travel and subsistence costs that occurred during the prior year audit. So we were rebated for that amount, and that was being deducted in essence from this year's fee. Is that correct, Jay?
Yeah, I guess to address the question of why it's reduced, as part of our efforts to be more efficient and effective, we are doing more on-site auditing in certain circumstances. So therefore, there will be increased travel costs and potentially subsistence stuff. So that's to explain why it's reduced as a rebate from the previous year.
David, does that answer your question?
Yep, thank you. Thank you. That's very helpful.
Thank you, Maggie, for that. I too am extremely concerned about the increase in rate. I would ask the head of finance to, and perhaps myself with me, to have a look at the original proposal from Audit Scotland. I would have expected, Maggie, that there would be a certain amount of on-site work factored into the original proposals and the original fee structure. So I would like to get some assurance that this has been done initially, and in order to be able to justify the explanation for the increase in fees. So perhaps that's something we can take away and perhaps report back to the next committee.
Sorry, Chair, could I maybe come in there? I don't want.
You can indeed, Maggie.
I don't want to leave any confusion. So I was there explaining why the rebate has reduced. So yes, of course, there is a certain element of travel and subsistence built into all of the fees. But in the situation where we don't use all of that, we give a rebate. So at the end of the previous audit appointment, we hadn't been doing so much on-site work because of the legacy of COVID. As we're moving back to a more normal situation, we are doing more on-site work, and that is why the rebate has reduced.
Okay, thank you. I don't have any further questions. Okay, well, in that case, the recommendation is that we note Audit Scotland's explanation for the increase in base fee, and we approve the proposed external audit fee for 23-24. Do we note the explanation?
Agreed, and approve as well. Yep.
And do we approve the external audit fee?
Agreed.
Thank you. Thank you both. Thank you, Maggie, for that. Now we move on to section 6 of today's proceedings, clinical care governance and the clinical and care governance assurance report. And I think, Kenny Ogilvie, you're presenting that report to the committee.
Yep, thank you, Chair.
Thank you,
The
Kenny.
Care and Professional Governance Forum continues to meet monthly, and all other governance arrangements across the partnership continue as previously reported. A full assurance report covering the period from the 1st of July to the 31st of October 2023 was presented to NHS Tayside's Care Governance Committee on the 5th of December, and it was also presented to the Council's, Perth and Kinross Council Scrutiny and Performance Committee on the 31st of January. A copy of that report is attached in the appendix, and in the report, the Chief Officer of the Partnership offered reasonable assurance, recommended reasonable assurance, and this was accepted by both boards.
Thank you, Kenny. Are there any questions for Kenny on this report, please? No, I see shaking of heads, but no questions. Any comments on the report? Okay, I don't even have a comment myself, which is quite unusual. In that case, can we ask the committee to note the responsibilities of Perth and Kinross Integration Joint Board in respect of clinical care and professional governance and those of the IGB's partners? Note the arrangements in place for providing the IGB with assurance that effective and robust systems of clinical care and professional governance are in place. Note that NHS Tayside's Care Governance Committee received a full report regarding clinical and care governance, which is Appendix 1, on the 5th of December 2023, where it was agreed as providing reasonable assurance. Note that Perth and Kinross Council Scrutiny and Performance Committee received the same full report as the above regarding clinical and care governance on the 31st of January 2024, where it was agreed as providing reasonable assurance. And note that the Chief Officer confirms the effectiveness of the above systems in place in the IGB's partner organisations. Are all those points duly noted?
Agreed.
Thank you, everyone. Now we move on to just some papers for information. The first one is the work plan for 2023-24. Are there any comments or matters arising from the work plan? No. And the work plan for 24-25? No. And finally, the record of attendance for 23-24. Can everyone please check that quite carefully and make sure there are no errors or omissions? Okay, well, in which case then that concludes the business of today's Audit and Performance Committee of the Integrated Joint Board. I want to thank everyone for their attendance. I particularly want to thank everyone for their patience while we addressed the technical glitches that delayed the start of this meeting. And I want to thank everyone for your contributions. So anyone who is external to the committee, if they can leave now, we can, or at least turn off the live recording and we can move into a private discussion.